Good evening, all. Welcome all aspirants to yet another topper interview of Marrow. So today we have Dr. Aanandi Dhavan. She has won rank 10 in the prestigious NEET-SS January 2026 session. So welcome Dr. Aanandi Dhawan to the show.
Thank you. Thank you so much, sir.
So first of all, let me congratulate you on the stellar performance. So overall, how do you feel now?
Thank you, sir. It was a pleasant surprise. I feel amazing. This was a bit of a tougher exam, so I was not expecting this rank, but it's a great feeling.
So you should be in cloud 9 now because it is. So what was the expectations? You after the exams, you felt that you will not be scoring this much high.
Nowhere near to this because I was expecting somewhere around 200 or so, to be honest. It went terribly bad, but maybe it was a harder exam, so it was tough for everyone.
Great. So it was a pleasant surprise to you, a shocker also.
Definitely.
Okay. So first of all, let's start with a brief introduction of yourself, where you did your UG, your PG, where are you currently, what are you working at?
Yeah, so I did my MBBS and MD from GMC at Chandigarh. After that, I moved to Bangalore and I was working with Rainbow Hospital in Bangalore. I took a break of about a month before the exam to study for the exam.
Okay. So now you are scored rank 10 and now you have decided to join pediatric neurology as your super specialization, right?
Yes, sir.
Okay. So when did you start preparing for the NEET-SS? Now I know that you have taken a break from your work. So, but overall, when did you start preparing seriously for the NEET-SS? Like from the starting of the MD days itself, or once you completed your MD and started working? When was that?
So basically, after MD, I was not sure whether even I wanted to do a super specialty or not. Before taking MD, I was absolutely sure that I wanted to do pediatrics, but after MD, I wasn't that sure. So, let's say about mid-August when I was working, then I particularly developed an interest in neurology, and that is the point where I thought that yes, now I should start preparing and I can do a super specialty in this. So around mid-August or so.
So your answer actually reminds me my MD days, because I also was very sure that I have to take MD pediatrics. But after MD pediatrics, I had no clue what to join, pediatric neurology or cardiology, and that was a late decision for me also. So late decisions are always sweet, and unplanned decisions are sweet, as your case has proven. So how was your preparation? Can you just brief about how you prepared? Like you have joined Marrow. Apart from that, how was your preparation of NEET-SS?
So basically, during my MD days only, I used to read Nelson, and throughout the MD days, I had made some notes from the Nelson itself, and I had those notes. I used the Marrow videos mainly for filling those gaps, and I used to love the Marrow videos. Like even though I had little time, but even then, because of the conceptual understanding and the depth they provided, I used to watch Marrow videos, and basically that filled all the gaps that were present in my notes. So after that, I did especially neurology videos. I think I've watched twice or thrice. You were an inspiration. Whatever I could not understand from Nelson, your videos were absolutely amazing. And so especially neurology part, I did very thoroughly, and that helped in this exam also. Apart from that, other videos also I used to fill the gaps in my notes, and after that I started doing the QBank. The QBank also, I must say, like it is on the harder side compared to other platforms, but for this exam, the pattern that came this time, I think it was a perfect mix. It was kind of a futuristic QBank.
Okay. So, anytime during your preparation, you have felt that you are not able to catch up, or there is so much of volume to study, because for like neurology, you have to learn other subjects also. So, was there any point where you felt that you are overwhelmed with the sheer volume of the subject that you have to go through?
No, I don't think so because already I had my notes, and throughout the MD, whatever we are learning is there, and those are the most important cases that we see and learn. So I don't think it was overwhelming at any point, but what was chaotic was choosing between focusing on INI or completely preparing for NEET-SS, because those two are different, like completely studying neurology for a dedicated 2 months or so versus doing general pediatrics. So that was a tough and a chaotic decision. But to navigate that, mostly I did my general pediatrics before the neurology part. And during the INI preparation also, I was studying some general peds.
Have you felt that preparing for Nelson and going through the Marrow videos, will it cover the whole curriculum, or one has to go through other resources also, like maybe online resources, other resources, articles, journals?
No, sir. Curriculum wise, I think Nelson and Marrow videos for conceptual understanding are perfect. Apart from that, only MCQs is the thing that we need to practice more and more. Articles, I don't think so. I saw any particular, especially online articles. Uh, yeah, I think that's it. Even the whole of the exam was line to line from Nelson only. The important topics, but in a lot of depth.
So there is a change in the edition recently. Nelson 21st edition now. Sorry, the next edition has come now. So was there a drastic change? How did you feel like during your MD days? It was the previous edition. Now then you have to shift to the new edition. So how did you find it difficult, or how easily did you navigate that program?
If you read like line to line, which I did especially for neurology, so there were a lot of changes. And other subjects also, I feel there would be some changes. But again, going through your videos, there were especially those snippets that used to come, the recent changes, the changes from 21st to 22nd edition. So those helped a lot.
Apart from the Nelson, was there any questions from biostatistics?
Yes,
That's one that's a high yielding topic.
Yeah, so for INI, I read biostats a lot, especially again from Marrow videos only. I had those notes and did some questions. Usually, NEET-SS doesn't have any biostat questions, or maximum one or two. So this time there were about 6 or 7 questions from biostats directly. So that was a big surprise. But as I had did my preparation for INI, so that helped a lot in solving those questions.
So overall, do you feel that there was a change in the pattern compared to the previous NEET-SS?
Yes, definitely. As in earlier, they used to cover a lot of breadth, but this time, along with that, there was a lot of depth to the questions. Like they were conceptual questions, so you had to apply your clinical mind to get to the diagnosis. But then the question that was asked was very factual. Like they would ask the locus of the gene described in that whole scenario. So you had to learn both the things. So a lot of depth, even though the topics were the most important topics only, but line to line from Nelson and a lot of depth was asked.
So how was the division of the questions? Like, was there any particular subject where more importance was given? Like neonatology usually gets more weightage. What about that?
So this time particularly, it was very evenly distributed, is what I feel. I think every year has a particular subject. Like previously, I think cardiology was asked a lot, but this time it was very evenly distributed.
Were there any pictures, any like in neurology, any MRI, EEG picture?
No, sir, not many.
Clinical picture?
Not many that I remember.
Okay, so compared to INI-SS, NEET-SS will be having kind of more of a factual questions. That's what you feel.
Not exactly factual questions. Like even the question stem was tricky. Like to get to the diagnosis also was not very easy based on the question stem. It was very clinical oriented, and then the question options were also very tricky. There is very minute differences between the options. So conceptual along with the factual understanding and learning.
So how are the new technologies like ChatGPT, AI, and all, did you use that technologies anyway in your preparation apart from whatever you have mentioned so far?
Especially for INI, I used to search for some previous year question papers. I did not used to find the answers anywhere. So for that, I used to go to ChatGPT or Perplexity or something like that to find out the answers, but not to understand a lot of things. Mostly it is explained in Nelson. Sometimes you some terms or some things it does explain in a more in a easier way, but not so much.
Yeah, superficially, what I feel is that superficially it looks very good, but it lacks depth. That's what I felt. One should have a core concept before jumping into technologies like ChatGPT. That's what I feel, personally, my opinion.
Yeah, definitely.
So, how did you develop an interest in neurology, pediatric neurology?
So as I said, I did not know. I really liked all the general pediatric subjects after my MD. That is what we are most exposed to. So after working for a while in the hospital, then particularly we used to get a lot of neurology cases, and it is very intriguing and challenging. So that I find very interesting. It is a combination of applying your brain, like applying some logic, then correlating it with your clinical findings. Then there is a mix of genetics, and especially it is very upcoming in the near future, I feel, with the advances that are coming up. So for that, I particularly liked neurology.
Okay. So, Dr. Anandi's words concluded that how it seems like you have particularly very well analyzed the question patterns compared with the previous NEET-SS, compared with the INA-CT. So, definitely, it shows that the commitment towards your preparation, the commitment towards your the subject, and overall it shows that how well you have worked during your MD days. Obviously, MBBS and MD you have done from a very prestigious institute, GMC Chandigarh. So overall, what is one message, or what do you feel, what is the one message that you want to give to the upcoming aspirants for NEET-SS Pediatrics?
So I feel while you're doing your MD, just enjoy learning, enjoy seeing cases, correlating them with what is written in the text, and I think that not focusing mainly on the MCQs and exams at that point, but just enjoying that learning process. I think that would be helpful, more helpful than just cramming up facts.
Exactly. So that's actually very important. Rather than going behind just solving the MCQs, actually after solving these MCQs, we are going to be clinical practitioners. So we are going to manage real patients rather than MCQs. So that part, I think, is lacking in at least some of the aspirants also. So we need to think from about a broader picture rather than just concentrating on the solving of the MCQ. So it was great talking to you, Dr. Anandi. So regarding the preparation, sometimes so aspirants may in between lose the hope, seeing the sheer volume of the MCQs, the load of the subject. They may get disheartened in between their journey. So for them, what do you feel? What is the message that you have to give to them?
To be honest, it is not a very difficult exam compared to what we've already done, compared to the MBBS and NEET PG that we gave. It is not that of a tough exam, and I personally went into the exam with no pressure. Um, like I did not really care about the rank that I was about to get, so that actually helped a lot. And so yeah, just keep learning, keep reading, and just focus on yourself, not what the others are doing. You do yours, as in everybody, I think, has some or the other problem going on in their life. And if you focus, like I have this problem, and that is why I am not able to read, you're losing hope. I feel that is not something you should focus on. Just focus on what you have to do, focus on yourself, and keep learning and keep doing these MCQs and reading Nelson.
So thank you, Dr. Anandi. I think that's a perfect reply to conclude a topper's interview. So like these are just minor things only. The life should go on. Our career, we have a broader picture to see rather than just a single exam. So just give your maximum. Just be cool. Don't be tense. I think that's how we can summarize your words. So thank you, Dr. Anandi, for joining us in this late evening. I'm sure you're going to be an inspiration to many NEET-SS aspirants. So
Thank
we'll
you.
be meeting in many other scenarios also. So welcome to the world of pediatric neurology.
Thank you. Thank you so much, sir.